Hi, I'm John Hovannessian here in San Diego at the ASCRS meeting, and I'm interviewing Cynthia Matossian from Matossian Eye Associates in Doylestown, Pennsylvania. Cindy, welcome.
Thank you so much. It's great to be here.
It is great to see you too. And we're going to talk a little bit about a new surgical offering for sealing closed cataract wounds, a hydrogel sealant. Tell us a little bit about this material that's called ReSure.
It's an FDA-approved sealant called ReSure Sealant made of hydrogel, which is a very comfortable material that's 100% synthetic, so there are no issues of viral transmission that one might find with fibrin glues. It is easy to apply and interdigitates into the incision and creates a wonderful watertight seal for cataract surgery.
And you and I have both worked in this, not only with patients, but in the clinical trials, and have experienced what it's like. And I think you'd agree it's not like a cyanoacrylate adhesive because it's very soft on the surface. And so most patients, once they have it, don't know that it's on the eye. Would you agree?
Absolutely. We actually did a trial where we assessed pain score after the application, and there was absolutely no difference between those patients who received the ReSure sealant compared to those who did not. It's like having a bandaged contact lens in your eye.
Except that it just covers the peripheral cornea,
Absolutely.
right? It's not the central, so it doesn't have an effect on vision. Now, if you were to advise a surgeon who really knew little about how to adopt this kind of technology, what kind of advice would you give? How do you learn how to use it, and what tips?
It's very easy to learn. Basically, one of the tips is to dry the area before you paint on the ReSure sealant. So what I recommend is hold a Wexel in your non-dominant hand, hold the ReSure sealant with the applicator in your dominant hand, dry the area, and immediately paint on the hydrogel sealant.
And then over what period of time does it polymerize?
You have to act quickly. You actually mix the components over 5 seconds. You apply it by the 7th second, and by about the 11th second, it starts to polymerize. So it's called the 5-7-11 rule.
And I don't know about you, but in my patients, since this has been approved, I've actually found that it's not necessarily for every cataract patient, but it's certainly something I want to have available in the OR. And I think most surgeons probably want to have it available. There are cases, a couple of kinds of cases that come to mind are patients who are going to have a higher risk of infection, or who might rub their eye, something of that sort. Patients where if I'm doing a MIGS procedure and putting in a stent, for example, and I want to maintain positive pressure in the anterior chamber, I don't want that hypotony. Closing with the sealant is very helpful to really make sure that you're not going to get hypotony.
Exactly.
And can you think of other examples in your practice?
I use it in patients who have a history of being MRSA positive, because I want to make sure that we minimize the risk of infection.
Sure.
I use it in my patients who are undergoing a variety of other surgical procedures like intravitreal injections for macular degeneration. Again, I want that wound as tight as possible.
Right. It makes sense. And I think, you know, we're speaking earlier about applications like if you're going to do intraoperative aberrometry and you need to have a well-formed eye with a high pressure immediately after surgery so that you can do aberrometry. Here's a good case where you might seal the wound, do your measurements, and then place your implant and then seal the wound again. You can do that because you've got 2 applications that come with this material. The packaging is set up so a surgeon can apply it twice in the unit dose.
Another good tip is I use the sealant on both the main incision as well as the side port incision. And we did data analysis to see if there was an IOP spike post-operatively. We didn't find one, but in the event that there is, you can very easily break through that seal in the office and do a release of the aqueous if necessary.
That's a great point. It's not such a firm sealant that it can't be displaced.
Exactly.
And so what happens to you when that occurs? If you are breaking through the sealant, what does the eye sort of look like later, and what then happens?
I've never had to actually break the seal, fortunately, but the eye looks very quiet and comfortable. And the blue dye is not trypan blue. It's FD&C #1 blue dye. And it's a very well accepted dye. It's used in food coloring and so forth, and that dye dissipates in an hour. So that's only there for the surgeon to make sure that the incision has a nice overlap.
Very good. Well, hey, thanks for taking time at the meeting here and in your busy schedule to talk with us about this.
Thank you very much.